Okay, class, we're now talking about anemia. Now, we talked about the normal, so now we're ready to talk about the abnormal, which can fortify your understanding of the normal. All right, so with anemia is a decrease in the normal of red blood cells less than normal, which is also a decrease, let's say, in the amount of hemoglobin. Now, hemoglobin is the major thing. Let me explain something. The three things you measure when you deal with red blood cells is the hematocrit, the red blood cell count, and the hemoglobin. But of all those three, always remember this, the most important is hemoglobin, because that's the one that actually carries the oxygen. So if I'm looking at three values, the one I'm more interested in is the hemoglobin. However, the other two should follow in line, but that doesn't always happen. Okay? Now, because anemia has multiple causes, a workup must be done. Remember, we talked about that. A workup is when a condition, like anemia or high blood pressure, has multiple causes. Then you have to delineate what the cause is, if possible, so that you can adequately treat the individual. Okay? Now, when we look at the symptoms of anemia, obviously without enough oxygen, you would quite naturally be weak, fatigued, and so forth like that. A little shortness of breath, trying to increase the frequency of breathing to compensate for this, and you'll understand even more about that particular aspect when you do when we do respiratory. Dyspnea is a fancy word for distressful breathing, and so forth. So you can kind of read on this. I'm just kind of giving you a setup so you can read. That's the symptoms. Okay. Sign I could see would be the person is pale. There are some other signs, but that's one of the major signs you could see. Okay. So here's a little pallor in that hand versus this one. You also will see something. Let me go back. This in an iron deficiency, for example, you'll see difficulty in the fingernails. So there's various things. All right. So we go history and physical. Okay. So let's go over here. Now, what is the diagnostic workup for anemia? It's the same workup you do for any condition. It's the same workup as far as the first part. The first part is new patient comes into the office, or older patient comes in that's been around. The first thing you do is a history and physical exam. Now that then in the history and physical, we would have known the signs, the symptoms, and everything in the history and physical. Then, after that, we would get an impression, and then we would do the complete blood cell count, the CBC. Then the CBC would say if the person's anemic or not. Now, if the person's not anemic, if the hemoglobin and so forth, person's not anemic, then there's no point in continuing with a workup for anemia if the person's not anemic. If the red blood cell count, hemoglobin, and hematocrit don't say they're anemic, then it doesn't take a great genius to know why I continue as far as down that road. Now, that doesn't say that they're not having a problem. They may be having a respiratory problem. It has nothing to do with the blood. You see, there are other reasons for this general tiredness and everything. Okay? But if they were anemic, we would look at that. We'd also look at the white blood cell count and the platelets, because if they have what we would call a pancytopenia, pan means widespread, then that means all the cells are low, which then kind of tips us to maybe looking at the bone marrow. But anyway, won't go too fast here. Then we would look, now many will not, because unless you go to a hematologist or internal medicine that really wants to get into it, then they may do a blood smear. Now, the average physician is not going to do that. The blood smear. Okay, let's just look at that. Remember, this is the blood smear, peripheral smear we call it. Okay, they may do that, and the reason is the CBC machine does have its limitations because it tries to average everything out. Then what you'll see in a moment, the reticulocyte count. The reticulocytes is the stage right before the mature red blood cell stage. The stage right before. We're going to put that in play in a minute. So I want you to really study this because this helps understand the normal. Then the lab test we might do is an iron, a B12, a folic acid test just to get an idea. If we have to, based upon what we find up to a certain point, we may have to go to a bone marrow study. Now, listen to me well. In clinical, it's least invasive first. I'm going to say that again. You might want to repeat that. In clinical, it's least invasive first. That means you do not want to invade into the body if you don't have to. The more you invade, the more risk. The more you invade, the more risk. So if you can get a lot done without getting an invasive, and bone marrow studies are, quote, invasive, okay, then it might be lost from the gastrointestinal tract. And so why do I bring up gastrointestinal? Because you could be bleeding from the intestine and not know it. It would just be coffee ground stain and you really wouldn't know it. All right. So that kind of gives just a general idea. Let's go a little further now. Here is a CBC example. All right. Now, right here, this is a small CBC machine that you would see in the in a person's office. Small CBC machine you'd see. Now, the ones in the hospital, of course, are considerably larger because they're doing multiple CBCs all at the same time. CBC stands for complete blood cell count. See right there, CBC. These are the things that you would see in a CBC. Now, in this PowerPoint here, go here, I kind of give you an idea of the CBC indices as they refer to red blood cells. Okay? Kind of an idea. But I have a new PowerPoint. I have a MS Word document that I created that you can also find in the A&P2 if you want to get a more detailed explanation for all of these values here, more detailed than I gave you here. So there is a document that you can look at that I created but it's in the MS Word. So you'd look down and you would see that if you want to. All right, we'll go a little further now. Okay. Now, what are the two main causes of anemia? The two main causes of anemia. Okay, it's like a branching tree. The two main causes of anemia, so I'll come over here, is either enough red blood cells are being produced in the bone marrow and released, but something's happening to them after they leave. Now, in this particular scenario, the bone marrow would be called central headquarters. That's the central. So once the red blood cells leave the central headquarters, they're in the periphery. So that's why we call it increased peripheral destruction, because they left this here and they're in the periphery. The other reason is decreased production. That the bone marrow, for some reason or another, the red blood cells are not being produced at the proper rate in the bone marrow. Now, remember, we're losing about 2 million red blood cells per second. Just normal. Because they only live a certain amount of time. About 120 days plus or minus 20. So we're losing about 2 million per second. About 2 million per second. What does that mean? To keep the normal count, we have to be making 2 million per second. So if we're not making 2 million per second, then what will happen is we will start to get anemic. Okay? Now, when I look at here, let's look at this, increased peripheral destruction, here are some things could do it. Hemorrhage, splenomegaly. The spleen is where red blood cells are sequestered. It could get so big that it could just take them out. Hemolysis, they could be breaking apart for some reason, might be autoimmune. Decreased production. Iron deficiency could be a vitamin B12. It could be a tumor in the bone marrow crowding out the normal bone marrow. So there are different reasons for that. Okay, but these are the two major reasons for true anemia. Okay, so we go a little further then. Let's go a little further. Here's that right there. Okay, and so now go to this next one. So increased peripheral destruction, what you would do in the evaluation is, I'm going to say that in the peripheral smear, see, the CBC may not do this, but in the peripheral smear, we would look at in the lab the size and the color of the red blood cells. If the size and the color, we'll see in a moment, is normal, that's a normocytic, that means normal size, normal chromic. However, over here, decreased production, it may not be for all cases. Now, it could be one reason for decreased production, a hormone problem. Where do I come up with that? So remember now, erythropoietin is the main stimulus for red blood cells. And erythropoietin is made in the kidney, a little bit in the liver. Another hormone that's the quarterback, the erythropoietin. But another one is testosterone. So a low testosterone could also give a slight anemia. But a low erythropoietin could give a major anemia, because that's the main stimulus in the bone marrow for this production here. The main stimulus coming from the kidney. Remember, the way the kidney knows is it's measuring the oxygen level. If it sees the oxygen level low, it will increase erythropoietin with the intent to try to increase the amount of red blood cells to carry more O2, more oxygen. Okay? All right. So we go further. So decreased production, we can see, causes, here's inadequate production, iron, so forth like that, you can look at. Increased destruction causes excessive bleeding. Red blood cells may be attacked, hemolytic. So various things of that, okay, that you can look at. Here's another chart that I pulled from a pathophys book to show you a decrease right here, inadequate production. Okay. Here again is our diagnostic workup. Our diagnostic workup, which we talked about earlier, you can see right there. Okay. Here is, as we alluded to, kind of explanation of this here. Now, when you look at this, I'm going to size it up a little bit here if I can. Go over here. Size it up. When you look at this, you can see red blood cell count, hemoglobin, hematocrit, MCV. MCV stands for mean corpuscular volume, the volume of the average red blood cell. Here is mean corpuscular hemoglobin. Corpuscle, C-R-P-U-S-L-E, corpuscle is an old name for cells, before even cells were given that name. A corpuscle, old name. They just kept it around for some reason. So mean corpuscular volume, mean corpuscular hemoglobin. What is that? This is the average amount of hemoglobin in a typical red blood cell. So seeing how much hemoglobin is in there. Okay. Then we look at mean corpuscular hemoglobin concentration, which is that's a volume of red blood cells that you have, and you're also looking at the hematocrit. And then the RDW is the size of the red blood cells. The size of the red blood cells. Okay. So that's what you're looking at on the CBC. Now I'm going to go further here. Actually, we're going to stop right there, and I'm going to pick it up right there with anemia 2. Anemia 2. Thank you.